Hello everyone. So my name is Asfandyar, just Aussie for short, and I've been a doctor for about 9 months, which means in comparison to many of my colleagues here, I'm basically the equivalent of a medical infant. So I'll be soon venturing into community psychiatry, where AI's potential and challenges are very clear. We've all engaged with AI, from advanced diagnostic tools to chatbots, and it's very exciting and perhaps daunting to observe the rate of change. So it's crucial that as clinicians and researchers, we stay adaptive yet rigorous as we integrate this technology into our everyday lives. So I'm here to engage with many of yourselves, but to share my perspective as a junior doctor. As junior clinicians, we're not just the future of clinical practice, but in the field where often it's improvisers, testers, and sometimes, unfortunately, it's crash test dummies. So now let's look at how healthcare is going to be reshaped. So as you can see on this slide, on the one side, we have the traditional, overwhelming aisles of medical records, a familiar sight in healthcare that symbolizes the substantial administrative load that doctors and nurses carry. And the other image, perhaps, represents a glimpse into the future. Perhaps a clinician using advanced AI to analyze patient data, to collaborate on complex decisions, or perhaps even the AI giving advice how to explain the disease to a patient appropriate to their level of knowledge. In just 5 years, the day-to-day responsibilities of a doctor, especially in psychiatry, will shift dramatically. Currently, up to 50% of a psychiatrist's time is consumed in administrative tasks, tasks that are crucial not just for clinical care, but often serve as legal documentation in court cases and tribunals. And this is where AI comes in, offering technologies like AI scribes and administrative tools that can free us from the burden of paperwork, allowing us to focus on what really matters: patient care and evidence-based medicine. Now, the transition will not be without challenges. Despite the existence of advanced technologies like MRIs and mRNA technologies, we can still grapple with outdated practices like paper-based records. So there's going to be a stark contrast in the adoption of this technology throughout the NHS. In Bristol, we still use paper records. A lot of people don't know that. So let's look at the ethical side, which Nina spoke about brilliantly, of using this technology. So as you can see in this slide, there's a balance between technology and ethics, much like a tightrope walker. And then on the other side, we have what I like to call the clinical innovation iceberg. At the top of this iceberg, we have regulated innovation. And these are implementations that have been tested, approved, and come with clear rules. And a lot of that testing is done, a lot of that planning is done prospectively. And drug research specifically is really great at getting this right. At the bottom, we have unregulated innovation. Now, these represent more complex implementations. These could be surgical technologies, workflow optimizers that aren't fully checked and are often analyzed retrospectively. Here at Bristol, we're quite lucky. Researchers are actively involved with the Introduce trial in pioneering new guidelines for complex innovation, specifically in surgery. And this rigorous academic work is going to be critical because it's really going to help us define the frameworks that we use to help integrate AI. So we've discussed the exciting potential AI holds. We've talked about its ethical landscapes, but I'm also now going to speak a little bit about how we as juniors can help contribute towards safe and effective integration. Now, our slide here visualizes a basic feedback loop showing the dynamic between clinicians, AI tools, researchers, and patient outcomes. And this cycle is pivotal for continuous improvement in healthcare. To bridge the knowledge gap between clinicians and AI developers, we really need to foster a collaborative environment, which is why I'm very happy to be here today. We need regular feedback sessions, joint workshops, and pilot studies. And these are just a few ways in which we can influence the refinement of AI tools. These are going to ensure that these tools are both clinically relevant and user-friendly. In practical terms, there need to be systematic ways to document and report how AI tools perform in day-to-day tasks, whether through digital feedback mechanisms, or educational programs. By engaging in these processes, we're not only going to enhance our own clinical practices, but contribute towards the evolution of the broader medical field. So I look forward to collaborating with people here and making this a reality. Thank you for listening to me. My time is up.